People living with a mental illness too often experience stigma at work, by friends, even from family. But perhaps the most unexpected source of stigma that can be equally, if not more devastating, is the stigma they experience from the healthcare system itself and the healthcare providers who treat them.
They let me slip through the cracks. And because I was so depressed, because I was in such a rut in my life, I wasn't able to reach out and really have communication with my doctor. Because of that, oh, dude, it made me feel so hopeless and so belittled and like I didn't matter.
They treated the symptoms to the point where they didn't care if there was a person there anymore, as long as the symptoms were gone, which induced a prescribing cascade.
I'm Dr. Stephanie Knaak. As a sociologist, I've been conducting research and evaluating interventions in the field of stigma and stigma reduction for well over a decade. From my widely published research, along with that of others, we know that the effects of healthcare-related stigma are serious. It leaves patients feeling unheard, rejected, invalidated, and leads to poor physical and mental health outcomes. Many are less inclined to seek help, having lost faith and trust in the very system that's supposed to help them.
It might be difficult to always advocate for yourself because most of the time when you're needing this kind of help, your self-esteem is at rock bottom, and it's hard to advocate for yourself in these situations, especially if it's a new illness, a new diagnosis.
Working with the producers of the award-winning anti-stigma documentary, Orchestrating Change, I've created a 1-hour online course that will give providers strategies and tools to reduce mental illness-related stigma in healthcare. This course, that will qualify for continuing education credits, includes stories from people with lived experience and focuses on practical and simple things healthcare workers can do that can make a big difference. For example, simple language changes and learning some basic trauma-informed communication and listening skills.
I wish that doctors would have acted a lot more compassionately towards me and really sat down and gave me the time of day.
I wish that more often doctors would have asked, what is your goal in this? What would you want?
Positive healthcare experiences have a big impact on treatment outcomes for people living with a mental illness. There's no question that healthcare providers are dedicated to helping their patients. That's why it's imperative that doctors, nurses, and staff learn where stigma comes from, assess their own unintentional bias, and most important, learn what they can do to improve recovery and quality of life for their patients.